Hi, I'm Sara Reidner. I'm one of the speech pathologists with PT Services here in Genoa, and I wanted to offer some help to parents of picky eaters. First of all, I want you to just relax because it's probably normal. Very frustrating, but normal. There was a study of 4,000 children that was done. They found that the prevalence of picky eating is about 28% in 3-year-olds, but by age 6 it was reduced to 13%. So that just lets you know that a lot of kids actually outgrow this. And it can be very, very frustrating if you have a picky eater. But what you really need to do is just calm down and relax, because if you get really frustrated, it can just make your child's pickiness even worse, and it can actually cause them to eat less. With a little bit of extra patience and creativity and perseverance, the end goal of having your child's food preferences increase can be met. My first tip is, don't be a picky eater yourself. Your child looks up to you, and if you eat something and make a funny face, they're not going to like that food. So children learn by foods and food preferences by watching you and your other caregivers. So at mealtime and snack time, make sure to talk about foods and their colors, their taste, the smells, and the texture. And also try to make sure you try some new foods yourself. Offer one new food at a time, a small portion of new foods at a time. So large portions can be very overwhelming to a child, making your child feel defeated before he or she even has a chance to try this new food. So with a small portion, your child can always ask for more if they like it. Offer the new food at the beginning of the meal while he or she is the most hungry. And then you can follow it up with a more preferred food. Remember that a serving size is 1 tablespoon per year of age. So here I have 2 tablespoons of applesauce, which would be appropriate for a 2-year-old. And I have 2 tablespoons of carrots and 2 tablespoons of pudding. So this would, not that this is a meal for a 2-year-old, but these are serving sizes that would be appropriate for a 2-year-old. Also, for some of those initial trials of a new food, you might want to actually give less so they're not so overwhelmed. And if you use some of these cute little party forks, that might be a little more fun and a little less overwhelming. To try a carrot with a cute little red fork that they get to pick out, they might like that a little bit better. You can make food more fun by presenting foods in a fun way. So keep meals pressure-free and fun. You can use cookie cutters to make some fruit skewers. So we have some hearts and stars and a little sunshine at the top. You can use cookie cutters to cut fruit, toast, lunch meat sandwiches, cheese, anything like that into some fun shapes. Arrange the foods into some silly shapes or figures, such as like ants on a log with celery, peanut butter, and raisins. There's several books out there or some online options you can find to help you along with this. Also, allow children to explore foods by touching and playing and ultimately tasting foods, which you can always do with chocolate pudding, which is always so much fun and a little bit messy. Get your child involved in preparing foods. You might both get what you want that way. Allow your child to pick out foods at the grocery store. Feel free to give him or her choices that you will follow through with. Which food would you like for dinner tonight? Would you like green beans or carrots? Involve your child in cooking, which will help him or her to be invested in the meal and therefore be more willing to consume the food that he or she helped to make. Some final thoughts. Keep offering new foods. Sometimes it can take up to 15 attempts at trying a new food before your child will actually accept it. Meals should take no longer than 30 minutes, so after that time, feel free to just be done. Also feel free to reward your child with extra playtime, with playing a game, or just some words of encouragement and some verbal praise. After trying all these tips for a while, if you still feel that you have some concerns, talk to your pediatrician and maybe for some further options like some speech or occupational therapy. Thank you.